This community update was brought to you by U Radio. Blood and related donations are always in high demand in Canada, especially as the population grows. Canadian Blood Services faces the ongoing challenge of engaging both new and returning donors. Raina Porter, Community Development Coordinator at the Winnipeg Donation Centre, says this November alone, Winnipeg needs 1,500 donation appointments.
And 174 of those, I'm hoping, are going to be new donors because we constantly need new people to come in to replace those who can't donate any longer.
Although half of Canadians may be eligible to donate blood, only 1 in 84 Canadians are donating.
So the first one I always say is staying up to date with eligibility. A lot of people self-select out, assuming they're not eligible, when in fact over 50% of the population is eligible, but only 2% actually do donate. And I think a lot of that is, people are busy and people have a lot going on, but I really think a lot of it is just people don't realize they are in fact eligible because we're changing our criteria all the time.
Misconceptions around eligibility often prevent people from donating, which has led CBS to review and broaden eligibility criteria, including removing past barriers. CBS took steps to remove previous restrictions on donors from the 2S LGBTQIA+ community. In 2022, the federal government approved a policy allowing men who have sex with men to donate, and CBS removed questions on sexual orientation.
It was really fantastic because in that same time frame, we also changed eligibility for anyone who is trans and has gone through surgery. No longer a question. Likewise, there are no questions on the questionnaire about what someone's sexual orientation is. The only questions we ask now is if you have had a new sexual partner in the last 3 months or multiple sexual partners. And then they'll ask additional questions after that one, should you answer yes. Nothing to do with sexual orientation or preferences, because that's not relevant what we're aiming for, which is blood donation based on the safest practices.
For those considering donating, general eligibility includes being in good health, able to perform your normal day-to-day activities, being 17 years or older, and meeting certain height and weight criteria if between ages 17 and 23. Donors can schedule whole blood donations every 56 days for men and 84 days for women. Plasma donations vary between 6 to 14 days, while platelets can be given every 14 days. Temporary deferrals apply to those who are pregnant, breastfeeding, or have had a recent tattoo or dental procedure. CBS's website also has a map for individuals who have recently traveled to areas with malaria risk. Booking an appointment is simple, and the appointment itself takes less than 45 minutes. If someone feels nervous while there, Porter says the staff work wonders to help.
You wouldn't be the first to get squeamish. The best part is that's all our staff here do. They are incredibly expert at being the phlebotomists that they are. They are in and they are out, and you don't even see the process because they're experts at it, and we love that they'll hold your hand too if you need it.
After the donation, snacks are provided, and blood samples are tested for infectious diseases, blood type, and compatibility, giving some insight into the donor's health.
And I don't know if you can get an appointment with your doctor as quick as you can get an appointment with us.
Porter encourages people to check their eligibility since guidelines are always updating. For those ineligible, CBS welcomes them to support others by accompanying friends and family who donate. To book an appointment, visit Canadian Blood Services website at blood.ca. You're listening to U Radio, where diverse voices connect. Stay tuned for more stories and insights that matter. With U Multicultural and the Local Journalism Initiative, I'm Ryan Funk.